All right, it's time to start. So, ladies, gentlemen, good afternoon or good morning, depending on where you are. Welcome to the Law, Justice and Development Week 2020 and to our session on public healthcare procurement during the COVID-19 pandemic. I am Enrico Canzio, and I am Chief Counsel and member of the Procurement Complaints Committee at the European Bank for Reconstruction and Development in London. One of the things that COVID-19 has made apparent is just how important government procurement is during an emergency. The strategies and approaches to tackle this crisis are and clearly will be different depending on the phase of the crisis, depending on the challenges encountered at each one. Yet all phases rely on one common denominator, targeted and effective public investment to ensure governments react swiftly to the consequences of the pandemic. And these public investments, be it for purchasing critical medical equipment or for providing essential services to the public and maintaining the relevant infrastructure, is always channeled through public procurement. Therefore, the chosen procurement strategy has an immediate impact on the effectiveness and ultimately on the success of the policies that are designed by government to respond to the pandemic and to its social and economic consequences. Now, in terms of healthcare procurement strategies, almost all governments around the world have been relaxing their national procurement laws. Why? To expedite procurement processes and to remove bottlenecks in the procurement of critical medical equipment and supplies. Now, with government spending at record high and less oversight on the use of public funds as a result of the relaxation of the procurement rules, it is highly likely that we will see a surge in fraud and corruption. And I believe this brings us to a fundamental question. In the fight against this devastating pandemic, do speed and urgency have to come at the expense of integrity and transparency? And if not, how can the key actors be held accountable without sacrificing timeliness and efficiency? So we will try to answer this question with the help of a great lineup of speakers. And I am really, it's a real honor to have such great speakers joining me today. So today we have Ana Cristina Calderon Ramirez, who is sector specialist in public procurement at the Inter-American Development Bank, Fiscal Management Division. Roberto Chiepa, Secretary General of the Presidency of the Italian Council of Ministers. He previously served as the Secretary General of the Italian Competition Authority. He is a judge and is also the president of one of the divisions of the Italian Supreme Administrative Court. Sean Derby, Senior Project Officer working for the Transparency International Health Initiative. Paolo Magina, Head of Public Procurement at the OECD. Paolo most recently was a board member and CFO of the Portuguese Central Government Shared Service Agency. And between 2010 and 2012, he also served as the CEO of the Portuguese National Public Procurement Agency. And last but definitely not least, Vinay Sharma, Director Solutions and Innovations in Procurement at the World Bank Group. Vinay was the Director of the African Development Bank Procurement and Fiduciary Service Department and also served as the Head of Operation and Management at the Delhi Metro Rail Corporation. So welcome all, and thank you very much for joining me today. So before we start, I just wanted to remind the public that you can ask questions, you can share comments by using the Ask a Question box in the World Bank Live page, and we will answer to your question during the Q&A segment at the end of our session. So now, without further ado, let me kick off our conversation by asking the first question to Roberto Chiepa. President Chiepa, Italy was the first Western country to be struck by the COVID-19 outbreak and to face the challenge of meeting a dramatic increase in the demand for gloves, face masks, hospital ventilators, and other critical medical equipment and supplies. The need to respond urgently, quickly to this pandemic, in a way the need to save lives, push the Italian public managers to make very bold decisions and speed up all relevant processes. And I think in the words of a leading Italian procurement specialist, Italy has been caught by a debureaucratization hormone and has destroyed the myth that public tenders require at least 15 months to be carried out. So, President Chiepa, you've been one of the architects of the highly praised Italian crisis response to the first wave of COVID-19. So what are the key policy changes that your government has introduced to trigger the release of this debureaucratization hormone, to expedite healthcare procurement processes, and ultimately to revive the Italian economy? And also, how is Italy ensuring that public spending, in particular in the healthcare sector, remains transparent, traceable, and accountable even during this dramatic emergency?
Firstly, I'd like to thank the World Bank for organizing this event, which I'm sure will prove extremely useful for our response on the second wave of the COVID-19 pandemic. Back in March, the situation in Italy was critical. The hospital on the verge of collapse, insufficient PPE, and not enough beds in intensive care. The government's response had to balance two different needs: respect for the principles of legality and transparency, and the need for a rapid response. The Italian government opted to centralize the management of the emergency in the hands of a special commissioner who was given sweeping powers and was tasked with coordinating the health service and the regional authorities. The commissioner could adopt measures in derogation from any existing provision, but in compliance with the Constitution, of course, the general principle of the legal system and the EU rules. No exception or limits were made for the application of criminal law. I want also to underline for the acts of the Commissioner that the law on liability of public officials for damages to the Treasury in procurement procedures was suspended except in the case of willful misconduct. And also oversight by the Court of Auditor was shifted from ex ante to ex post control. During the second phase of the pandemic crisis, its effects on both the economy and the healthcare system highlighted the need to accelerate the working of the public administration in general and procurement procedures in particular. The legislative response to this was the simplification decree passed on July 2020. And in this decree, important changes were made to the procedures for awarding public contracts, to administrative procedure in general, to speeding up digital innovation with simplified procurement rules for public contract above and below the EU threshold, and with facilitation for contracting authorities when using the negotiated procedure without public tender above the EU thresholds. Transparency is an integral part of these new procedures because all the decisions adopted without a tender are published and no derogation has been made to current anti-mafia law. The decree extended to all public officials the limitation for liability for damages to the case of willful misconduct that was initially designed, as I said, for the commission activity. And this limitation, this is an important aspect, this limitation don't cover damages caused by inertia and omissive activity. In this case, the responsibility for gross negligence remains. If we add also the delimitation of the abuse of office as a criminal offense, I think that criminal sanctions is not the remedy for maladministration. We can understand how these reforms has the goal to avoid the fear of public officials to adopt decisions. Some of these legislative changes are experimental. We intend to observe this model and then decide which tools to adopt permanently, which to modify and which to discard. Once perfected, it can then be exported to other sectors of the public administration and by inference of the economy at large. Your question is on the bureaucratization, and we are conscious that Italian bureaucracy is seen and experienced as a stumbling block to the development and relaunch of the country, and by extension to the management of the emergency. I think that the problem is not to eliminate, contain, or reduce bureaucracy, but to strengthen it to give the country a bureaucracy that works, and above all, that exercises judgment, doesn't fear responsibility or avoid decision making. Complexity, I think that complexity favors inertia. Those who do nothing don't make mistakes, but this must change in the future. And we also to consider that complexity also potentially favors corruption. And on the contrary, simplicity favors transparency. I want to close my first answer with the consideration that the simplification of the rules is the best antidote to the corruption.
President Kippa, thank you very much indeed for the great insight on the Italian policy response, and I can't agree more with your conclusions. I wanted to move now from a national dimension, so from the Italian dimension, to a broader dimension, and see how the Italian experience somehow resonates at an international level with the help of Paolo Magina. So in a way, the procuring essential products and services under extreme urgency is not a novel concept for public authorities. Actually, I think almost all countries around the world already have well-designed, well-tested special rules governing tendering during emergency. However, it became obvious at the very onset of this worldwide health crisis that COVID-19 was not a crisis like no other, was an emergency like no other. It had created a purchasing environment, in particular in the healthcare sector, which was never before experienced by public contracting authorities around the world. And obviously this unprecedented condition not only increasingly they heighten but also fundamentally change the exposure of the procurement system to integrity risk. So, Paolo, you and your team are playing a critical role in collecting evidence on how governments in both OECD and non-OECD countries are responding to this unprecedented condition, to these unprecedented challenges. And I would like you to provide us with a quick snapshot of the key policy measures in the healthcare procurement sector, which government, both OECD and non-OECD countries have been adopting to tackle the first wave of COVID-19. And also, I'm interested to hear about your policy insight in terms of the accountability and transparency of this COVID-19 emergency contracting.
Thank you, Enrico. Grazie. Thanks for the opportunity to provide a view on the OECD and non-OECD countries around this very interesting topic. As you mentioned, procurement represents a huge amount of money. We are talking about 12% of GDP in OECD countries. It can easily go to 20% or even more in different countries and regions of the world. Just to put a number to what you said before. So finally, I think people realize the value of procurement, the importance of procurement, and the capacity of procurement to provide responses to the many challenges and questions that came with the pandemic. And indeed, you mentioned that countries already had the procurement frameworks to deal with emergency. That is correct. The question is that usually these emergencies were localized and were not exposed to the entire globe at the same time. So it was totally a different environment. So I would like to maybe focus the first part on this purchasing environment that changed substantially. So there was a fierce competition between the public buyers inside even the same country for the same vital products and services. Countries also imposed the export prohibitions and restrictions on essential goods. So there was a serious disruption in supply chains. And then the market started to behave very erratically. So many suppliers demanded advance payments. We saw some fraudulent suppliers as well. There was a huge increase in prices and a higher risk for counterfeit products. So all of these purchasing environment created a lot of challenges in the procurement processes. And in fact, we collected some evidence. We have a stock-taking report on more than 30 countries' response to the crisis. And we also developed a policy brief that is available on the OECD Digital Hub for the COVID. And there you will see that the challenges faced by the the countries were significant. And we did a webinar back in June where we asked more than 300 participants and practitioners what were the main challenges they faced in terms of dealing with these two most pressing issues. One was how to respond to the emergency, but then there was a second issue, how to manage ongoing contracts, which is also an important topic that procurement had to deal with, how to ensure that the contracts were going. So we asked this question, and 80% of the participants they mentioned the disruption in the supply chains. And then the second most big topic was the increased prices with 40%. So you see that this created a huge challenge to them. So how did countries reacted? We saw the emergency contracting picking up. We saw many countries bringing strong and clear support to the buyers, developing guidelines and promoting also knowledge about emergency contracting. We also saw some collaboration in terms of joining forces, and even federal countries like Germany started to look at centralization and the role of central purchasing bodies as important as well. We also saw new means of engaging with the market to try to find alternative and innovative solutions. And we saw many countries coming up with also adaptation in terms of the industries to try to respond to the cuts in the supply chain. And finally, we saw more digitalization. So the e-procurement systems were available and many countries were using them to a large extent. But what we saw was an acceleration of the use of e-procurement. Suddenly, they started to do everything virtually and digitally. So they had to respond to this. So we have many examples for each of these responses. For instance, Australia and Italy, they adapted the industries. We saw New Zealand coming up with cooperation in terms of trade. We see also Germany, Ireland, and Italy bringing collaboration. So there are many examples that you can find in our policy brief regarding these responses to the crisis. And the final point I would like to mention is this aspect about transparency and accountability. In fact, we saw many OECD and non-OECD countries promoting increased transparency by having record keeping and publishing the so-called COVID-19 related contracts, providing clear guidelines on emergency procurement, and also setting up central prices and supplier tracking. And finally, developing verification of suppliers and the quality of supplies. For instance, Lithuania even developed a portal for COVID contracts. So you see, there are, of course, there were very many challenges that procurement systems faced, but I would say that procurement systems were also capable of replying positively to these challenges and coming up in a stronger position to face the difficult times we are facing. Thank you.
Paolo, thanks. Thanks a lot for the excellent overview of the things are reshaping the procurement systems around the world as a result of COVID-19. I would like now to shift the focus of our conversation from the government policy response to the crisis to the pivotal role that the multilateral development banks, the MDBs, are playing during the pandemic. I guess if you could all mute, thank you. With the number, as you know, with the number of coronavirus cases growing dramatically around the world, the client countries have been increasingly requesting emergency support from the MDBs as they tackle the pandemic. And the World Bank has once again been leading the way by putting in place several measures, including the launch of the fast-track COVID-19 facility to provide emergency support to its clients, in particular in the healthcare sector. So my next question is for Vinay. So Vinay, how does this fast-track COVID-19 facility, which I understand is one of your flagship initiatives during the pandemic, fit within the World Bank overall public procurement policy and institutional framework. Also, in expediting procurement processes, in moving from an ex-ante oversight to an ex-post review approach, how is the World Bank, and in particular your team, ensuring that integrity, transparency in public procurement for World Bank finance project is maintained at an appropriate level?
Okay, thanks, Enrico, and for this question and for inviting me to the panel. As Paolo and Roberto had said earlier, I think this was a pandemic, an emergency like no other emergency. And we had also done a survey some time ago of more than 106 countries where we found that there was a direct link between the quality of the institutions and the quality of the procurement systems and the health outcomes. But at this time, as you have mentioned, Enrico, I'm going to talk more about the World Bank's response to the pandemic. As you know, the World Bank rapidly organized a significant funding to assist countries deal with the pandemic. And we recognize that the usual market norms are no longer present. And therefore, the World Bank's pre-existing emergency procurement procedures were used in conjunction with more efficient, more accelerated internal administrative and government procedures. They included fine-tuning and customizing existing policies, guidance and tools, as well as adding new ones. Several documents were prepared, notes were prepared, communications were quickly issued, and they were communicated to support the project teams. We had a comprehensive generic project operational manual for projects financed under the COVID-19 pandemic for preparedness and response program, and that included the procurement procedures that could be used and support to the task team leaders and to the countries. It includes substantial COVID-19 procurement related information. Now, what we obviously recognized was that increased flexibility has to be applied, and including the use of direct contracting and single source selection. The project units for procurement transactions involves the use of banks' hands-on and expanded implementation support, what we call HICE, when needed and requested by borrowers. They were encouraged to use their own emergency procurement procedures, implementation procedures, e-procurement systems, even for large contracts, as they are generally more familiar with their own national procurement methods and documents. In addition, alternative procurement arrangements, including purchases through the UN, were also used. Since time is of the essence, what we decided to do was, as we do for many emergency cases, was to do away with prior review for most of the contracts and then do the post-review of those contracts subsequently. This is, I think, what Roberto and Paulo had also mentioned was done in their cases as well. So periods given to the bidders were reduced to have expedited bid processes. Bid securing declarations were used instead of what recommended instead of the bid guarantees, because sometimes the commercial banks themselves were not able to issue bid securities. An increased percentage of advance payments was provided, in conjunction, of course, with bank guarantees. The use of direct procurements by direct payments where the bank, on request by borrowers to suppliers and contractors, was increased, and to expedite contract payments and to speed up contract execution. We also started a new instrument which is called the Bank Facilitated Procurement, which is an enhanced form of the HICE, as I mentioned before. This was essentially for emergency procurement of medical equipment and supplies. Under this tool, the bank aggregates borrower demands, identifies suppliers, and negotiates contract conditions and unit prices on their behalf upon the request of the countries themselves. So the bank doesn't do anything without the request of the countries. And the borrowers remain responsible for the contract, including signing and managing the execution, and therefore the fiduciary, the operational boundaries of the bank are respected. So it was very clear that the bank was not doing something that it was not required, it was not permitted to do under its charter. And then to mitigate the risk in COVID-19 procurement, specific fiduciary arrangements were used. All contracts are registered in the IT tool that we have, which is the systematic tracking of engagements in procurement, or the STEP system. This enables bidders to be screened for eligibility purposes against the bank's list of debarred and temporarily suspended contractors because of their involvement in fraud and corruption. contract awards, including those subject to post-review, are now automatically published on the bank's website. I think this was one of the major decisions that were taken. As you know, the bank is required to publish only the prior review large contracts on its websites, but this time we have decided that every single contract, irrespective of the site, is going to be put on the website. So from 1st January of this year, the website has even small contracts that were normally not published. And then we also developed an online post-review application, which is integrated with STEP, and which was activated about 2 months ago, or 2.5 months ago. And it makes it easier to conduct procurement post-reviews virtually at a much faster pace. We are also now trying to use artificial intelligence and machine learning to do reviews, post-procurement reviews. And all COVID-19 projects are subject to be post-reviewed, and we hope that we would be able to complete most of this by the end of this month. And when a project applies for retroactive financing for some contracts, the bank conducts extensive reviews and requires that such contracts be amended to include the standard clauses on fraud and corruption, and the bank's right to conduct an audit and inspection of the contractor's files. So these are some of the measures that we took. I mean, as you know, there are many more. The total procurement has already exceeded $2 billion. At some point, it used to be more than $50 million every single day. And we are making sure that the fiduciary standards of the bank are not compromised in any way. Thank you. Let me stop here, Enrico.
Thank you very much. I have to say that your leadership and the work of your team in responding to the pandemic are truly inspiring. So thank you. I would like to continue focusing on the MDB's perspective on this unprecedented crisis with the help of Anna Cristina. So Anna Cristina, the IMF Spring 2020 Fiscal Monitor, which report on the size, on the nature of the fiscal measures that have been undertaken around the world in response to COVID-19, recommends that due to the urgency of this intervention to protect lives and livelihoods, countries should do whatever it takes, but make sure to keep the receipts. And my question to you is, what are the main pillars of keeping the receipts in the healthcare sector? And also, which public financial management practices would you recommend to countries in this respect, in particular to those countries whose institutional capacities are constrained or where the fiscal governance is relatively weak?
Well, Enrico, let me start by thanking you and thanking the EBRD and the World Bank for inviting me to this conversation and with this discussion, and for giving me the chance to talk about the critical relationship between fiscal governance and government procurement. And to answer your question, I will say, okay, it has two parts. First one, the conceptual part of it. It means that we acknowledge as an international organizations that governments around the world have been doing whatever it takes to provide fiscal support packages, the ones that were explained in Vinay as a fast-track initiative, and those packages were done to address the COVID-19 impact. And this was to make funds available in a timely and effective fashion. And the regional organizations, the regional development banks, as well as the IMF, in my case, the Inter-American Development Bank, and the Fiscal Management Division where I work, we have been supporting that speedy response by governments, and we have advised them in keeping the receipts. And in this context, it means three things: ensure fiscal transparency, ensure public accountability, and ensure institutional legitimacy. And the underlying argument here, what is critical here, is we are promoting an efficient response, but at the same time, we are promoting the following the values and the principles of public spending, meaning integrity, openness, accountability, and transparency. But how does this really work in practice? And that's the second part of the answer. Well, keeping those receipts requires a lot and a big fiscal management infrastructure, and not all countries have them. Indeed, prior to the pandemic, my colleague Carola Pesino, you can follow her Better Spending and for Better Lives research, she found that due to public inefficiencies, the inefficiencies in public spending, they represent an average of 4.4% of Latin American GDP. So what can you do? And here you're asking me some recommendations, and here's my disclaimer. Be careful and never forget that context matters. But governments can start thinking about first considering a priority-based approach, and doing the reprioritization of spending based on questions like what and when, what is needed, when is needed, what is our ability as a public sector to do something, and picture your actions in the short, medium, and long term. The second one is during implementation, focus on a results-based approach, and this allows to have a better coordinations among different organizations. For example, in the case of public procurement, to make sure that our public procurement officials are really talking to the subject matter experts so they can do needs assessments and technical specifications that really meet the criteria and that really meet the results that are needed. The third one is communicate. Communicate with your stakeholders. Think about how can you engage them, think about how you can be more transparent, more open, how to involve the civil society on this. And the fourth one, and is more transversal, is focus on monitoring. And in order to, I mean, this crisis is a marathon. It is not a sprint. And the issue here is you have to stop and reassess to readdress. So you need to keep this monitoring, and to do the monitoring, and I'm going to follow what Paulo said before, you need to track and compile accurate data of your actions. And then use your integrated financial management systems, use your online procurement platforms. Look what you need to do in the short term and in the long term. In summary, keeping those receipts is not an easy task, and we know that. But having in mind those three pillars, the fiscal transparency, the public accountability, and the institutional legitimacy, that will help to manage public procurement and public financial management during the crisis, but as well what is going to happen after this crisis. And here I'm going to say we need to avoid what I call the Hotel California situation. For those of you that know the song, the Eagles song from the 70s. In that song in which you can check out anytime you want, but you can never leave. And what we really want is the public procurement systems and fiscal management institutions could deal with this crisis, during this crisis, and for this crisis, but also after the crisis passes. Thank you.
Ana Cristina, thank you so much. These are excellent, very important measures that I believe all governments around the world should consider if they want to reconcile speed and integrity in their healthcare procurement processes. And also your reference to the need somehow to engage with the civil society, which is a critical stakeholder, help me to transition to the next, to my next question. So insofar we have looked at the government policy response, we look at the role that OECD or other international organizations such as the MDBs are playing during the pandemic. Now, I'm curious to hear the insight of another key stakeholder, which is the civil society. And now I need some help from Shan. So Shan, Transparency International Health Initiative has been working very hard to improve transparency, to improve accountability of the healthcare procurement strategies during these processes, during this pandemic. And I have to say thanks also to its excellent work. Numerous cases of fraud and corruption have been uncovered by auditing, by law enforcement institutions. They have been documented by investigative journalists. Your team also, like Shanna, you and your team are also working very closely with the several Transparency International local chapters which are spread around the world. So I'm curious to hear, what are the main findings as to the integrity, as to the transparency of the COVID-19 emergency procurement in the healthcare sector on the basis of the evidence, of the data that you are actually gathering, you are collecting from your local chapters? And also more in general, what do you think is the role that organizations like yours, the civil society, can play in rooting out opportunity for corruption during this pandemic?
Thank you very much, Enrico. And again, thank you to the World Bank for the opportunity to present at this conference. I think just as a bit of context to start with, a few of the previous speakers have spoken about how countries have emergency procurement legislation in place and stringent procurement processes which were able to pivot to emergency procurement. However, in a lot of the contexts where we work, that's not the case. So the chapters we work with in normal work on procurement transparency to try to work with stakeholders from civil society, the private sector, government at local level, national level, in order to increase the robustness and transparency of the health procurement system. So in normal times, this means focusing on a process we refer to as open contracting, which is a broad term for a range of approaches and tools that focus on increasing transparency in the procurement process. This approach may vary between contexts, but includes increasing social accountability mechanisms in procurement using techniques like monitoring of specific contracts at the ground level to, like you were talking about, larger scale analysis of big data sets. Ultimately, you want to try to able to have citizens feed into and close the feedback loop of the procurement system. During the COVID pandemic, we tried to pivot these principles and apply them to emergency procurement. So in many cases where data was available, the chapters were able to use it in real time and start to try to highlight corruption risks. So one of the examples is in Uganda, the chapter helped identify that government officials were using emergency procurement legislation to artificially increase the price of emergency food supplies for their own benefit. As an external actor, they were able to bring this case to the public, which resulted in the officials being disciplined and ultimately removed from office. But many of the principles that we've been speaking about and some of the other speakers have gone into weren't being applied. So Kenya, there was emergency data for procurement for quite a while, and they've released a section of that now. So in that case, civil society's role is to advocate for that data to be released. Like Anna was saying, if you're collecting the receipts, you've got to then release those receipts so they can be applied by external people. And so now, with more information slowly being released on what the government spent, how much it spent, and how those decisions were made, the role is to sort of retrospectively analyze that data. So in South Africa, we're conducting a large-scale mapping of all the procurement information. It being that once this has been analyzed properly, we'll be able to highlight where there are potential corruption risks and use that to advocate emergency procurement legislation in the future. This means that if there is another emergency, or as this emergency continues, countries will have a clearer plan to respond and mechanisms to allow them to do that clearly. So civil societies can play an important role in reducing opportunities for corruption by providing more stringent systems and then advocating for them. If we think of corruption in the most basic sense of having a monopoly of the power and then complete discretion or able to make decisions in any given situation of accountability, then that civil society can come in to reduce those opportunities. This is primarily done through accountability mechanisms of the process. If civil society can analyze the data that is available, they can identify the potential cases of corruption and not only hold those at fault to account in the immediate response, but also use these examples in order to advocate for systems in the long term. So in short, the role of civil society is to hold governments to account and to as much as possible remove those opportunities. Thank you.
Sean, thank you very much indeed. And I have to say, based on the evidence that you are gathering from the ground for some of the jurisdictions from the countries where your chapters work, it seems clear to me that there have been several flaws in the healthcare procurement strategy initially deployed to tackle the first wave of COVID-19. I think this is also somehow supported by what we are reading every day on the newspaper. It was today published on the FT in the report from the UK National Audit Office, which heavily criticized the UK government for the pandemic, from the crisis response, and exactly like the raised issue in terms of transparency, risk of conflict of interest. So it's clear that there have been flaws in the design of this crisis response. And now we are facing a dramatic second wave of the pandemic. Not only that, governments around the world are getting ready to run the monumental task of procuring and distributing millions, if not billions, of doses of COVID-19 vaccine, together with all associated medical equipment and supplies. So my question for Vinay, Paolo, and Roberto is, are we better prepared now? Have we gained a better understanding of the consequences of the COVID-19 crisis, and in particular the flaws in the emergency procurement strategies deployed during the first wave of COVID-19? And if so, did the government manage to adjust their procurement strategies, their infrastructure strategy in time to enhance both effectiveness and resilience of their procurement systems, in particular in the healthcare sector? And guys, mindful of the time, it would be great if you could keep your answer within 2 minutes each. Thank you. We can start Vinay, then Paolo, then Roberto, please.
Thank you, Enrico. I think there are a few lessons that we have to learn. Number one is, I think that the pandemic sometime in February and March took everyone by surprise. And therefore, it was difficult. I mean, of course, there was no global response. I think it was even difficult to have a globally coordinated response. There have been some changes in the meantime. I think there have been a lot of discussions, and I see 2 or 3 very clear indications. Number one is that the civil society organizations within the countries themselves and the audit functions are, they have played a very major role in asking questions that are supposed to be asked. So we see in many countries where questions are being asked of the government from the independent oversight bodies and the press and so on, and that is keeping the countries on their feet. The other thing that we are seeing is there is a resurgence in the use of technology, e-procurement, and particularly as a solution. I mean, the SaaS, where a lot of countries are now realizing that they would be able to achieve economy, efficiency, equity, and effectiveness through the use of e-procurement systems with greater transparency. So we can see that there is a greater acceptance of this. We also see that there is already discussion going on, about the COVAX facility where the countries are getting together. The Gavi, UNICEF, WHO are getting together along with the World Bank to have that discussion. So I do believe that the chaos that was created in the first phase of COVID, we would see less of that and perhaps a more coordinated response either in the second wave or in the distribution of vaccines. Thank you.
If I may, then, building on what Vinay said, and I think he touched upon very important topics that we also identified. Countries, the approaches that countries took are here to stay, and I will say that they will also be part of the strategies for procurement systems going forward. I would say that, relying on cooperative and collaborative approaches, auditing contracts, not just emergency procurement contracts, but also providing audit, and Vinay also mentioned that. But also looking at data-driven approaches for contracting and how to extract value from these data-driven approaches. And we heard previous speakers talking about artificial intelligence and IT tools to understand how procurement is spent. And also the issue of digital tools to ensure bigger transparency and accountability. And Vinay also touched upon this topic. But I would like maybe to highlight 3 main areas that we see as trends emerging in countries. The digitalization of the procurement process, I think it's clear for everybody. But also looking at risk management and these increased risk management approaches, looking at the entire supply chain, looking at the resilience of the supply chains. It was something that was not done before, and that is going to be very useful going forward. And finally, strategic sourcing, that was, of course, used in many occasions and by many countries and many contracting authorities. But we see now these strategic sourcing approaches becoming much more common. And there is a discussion that is coming at the OECD, at least among our members, about essential goods. What does it mean, essential goods and services? What does it mean bringing resilience, not just to institutional settings, but also, to processes, to infrastructure? So I think it's very important that we take these aspects going forward. And Enrico, you mentioned the billions of money that will be spent, in the next years, and the role of infrastructure and procurement. And that was precisely one of the reasons why the OECD decided to bring these work streams together since the beginning of the year, understanding that procurement plays a very important role in delivering infrastructure. And finally, maybe I would like also to follow Anna's example in bringing a song. So maybe, this is procurement's time to shine. So I would just maybe finalize by saying there is a light that never goes out, taken from the Smith song from the 80s. Thank you.
Thank you. So Roberto, please.
Well, I think that the aim of the government during the second phase is to strengthen the model and tools brought in to deal with the first phase, continuing to innovate and digitize procedure in healthcare, but not only in healthcare procurement system. I think in the economy in general, to close, for instance, for Italy, the gap between Italy and other countries. One example in Italy is the digital dashboard that we introduced to manage the emergency. It is a complex system of monitoring data from our regional health system, which centralize information and ensure rapid intervention to address critical situation with appropriate and diversified measures. It is undoubtedly a model to extend to other fields. And I think the correct approach is to extend something that we experiment for healthcare system to other fields. We now have a window of opportunity to learn from the measures adopted during the emergency, to confirm those that we have proved their worth, and to adjust or discard those that fail. Innovation and digitalization must play a central role in changing the face of Italian bureaucracy, also other countries, to ensure a positive knock-on effect on the market. This is vital to ensure in Europe the EU Recovery Fund can leverage the country's economic rebirth. And it is also vital because EU countries around the world must avoid creating a nationalist framework which could limit competition and consumer choice after the emergency. We have to remember that competition favors innovation, innovation boosts economic growth. In this perspective, the Italian government has recently recognized the right to innovate with simplified procedures and derogation from the regulation in force for innovative projects with a social, economic, cultural, or scientific impact. By carefully balancing change and innovation in the civil service in the market, Italy hopes to emerge from the crisis with a more proactive, robust, and resilient system of administration and procurement. In this perspective, the pandemic has acted as a driver to both government and business to bring about an important cultural change in the country, as well as to innovate and digitize the system and procedures. This is, I think, a great opportunity, but we have to avoid the risk that the emergency will leave us a world with fewer rights and less freedom.
Thank you very much. I have to say it's quite unique to find a situation where all the interventions, they are very similar. And I think the emphasis of all your intervention is on the opportunity that come out of this crisis, opportunity for innovation, opportunity for digitalization. In a way, when we look at the procurement function itself, I think this crisis sheds light on the need for more innovative thinking about government acquisition, for a more strategic, more central role for the public procurement function, and generally, as President Chiappa just mentioned, for a more dynamic, a more risk-based approach and culture in the procurement system. So my question to Anna Cristina and Shan is what is needed for the procurement system, for the procurement function to become more central, become more strategic, to embrace this risk-based approach, not to be focused just on compliance, not to be deemed, not to be treated as a clerical function within the public administration, because the challenges are too big. Without a public procurement function that is able to deliver the crisis response, no crisis response, no COVID-19 crisis response will ever succeed. So what is needed to change the procurement function without, at the same time, without compromising on the integrity of and transparency of the function of the processes themselves?
Well, Sean, I will.
Anna Cristina, if you can start. Yes.
Yeah, I was going to say, Sean, I will try to go first, and then. Well, Enrico, I believe that due to this crisis, we are having fundamental conversations that we never had before, or we were postponing and we were not prioritizing. And one of them was this one, how to make the public procurement function more strategic and with an integrity approach. And Paul is here, and Vinay, we have been working with the maps and professionalization assessment. But indeed, we need to find a way to really have this conversation in depth and to move forward to action. But I will add some stuff. I don't want to sound as a broken record here because everybody has said similar things. But first one, I would say we need to put in place
I think, Anna Cristina, you're breaking out. Anna Cristina, maybe you can put off the video and just use the audio and see if it works. Otherwise, maybe Shan, you can chip in until Anna Cristina managed to resume.
Yeah, I'll jump in and then Anna could jump back in when she's back. I think that in terms of increasing the accountability and transparency of these systems that you're talking about in the future, there's a few things. One, which is quite simply just having a plan. We see that in other sectors, like countries that have high rate of natural disasters, that there's always a disaster response plan. They know what they need in advance if there is a humanitarian crisis, so that they then have a list of suppliers who already have done due diligence on, so that they can respond more quickly. And in addition to that, like Roberto is talking about simplifying the rules, which is very good and very clear, but it's very important that those rules are publicized. I'm not saying they're not in Italy, but in other countries, and so that everyone is aware of them. If you're going into emergency procurement, it needs to be very clear how many days that's going to last for, and it's going to be reviewed, and all of the processes that are there. I think in South Africa, they changed their emergency procurement laws 3 times, 2 weeks during the pandemic, which obviously gives a lot of opportunities where there's gaps for people to work around them. I think the last thing I'd like to add, sort of in response to some of the things that have been said, everyone has spoken about e-procurement, which is fantastic and it's great as a tool. I think there's a danger sometimes of holding it up too high as the silver bullet that's going to fix all of our problems and can be done in isolation from addressing the policies that surround that to make sure that those e-procurement systems are used. And also to make sure that whilst having a great detailed e-procurement system at country level might be useful for analysis by people at a high, like international level, it often might cut out people at a local level. So at the said, procurement's in the news everywhere and everyone's engaged with it and everyone knows how important it is. If we start making it just technical and just online, to exclude a lot of the people who ultimately this procurement processes should be benefiting and should be working for. So you need to make sure that there is a balance. Those people are still able to hold their governments to account and not remove that information totally by making it too much on no extra parts to it.
Thank you, Shan. Thank you. It's really great intervention. I noticed that we still have some issue in terms of connection with Anna Cristina. So I suggest we start looking at the question. I see a couple of interesting questions that the public has raised. So I was thinking on the first question, maybe Paolo, you can chip in if you have any suggestion. I will read the question. So to what extent has COVID motivated countries to create domestic preferencing requirement for procurement to increase domestic manufacturing capabilities? Paolo, do you think, is this something that you are seeing in your review, in the evidence you're collecting from OECD and non-OECD countries? And what is your insight on this?
Yeah, it's a very good question. Yes, we partnered with WTO and we tried to understand the barriers to trade and how this was impacting also the supply chain. And we see, in fact, some countries moving into these domestic preferences. But at the same time, we see the response coming from regional blocs like the European Union that is taking a regional approach, in terms of the vaccines or in terms of the purchase of PPEs and other equipment, that they are taking this regional approach. So I would say, yes, this is related also to the discussion on essential goods that I mentioned before. What does it mean, essential goods and services? And how countries are ensuring that these essential goods and services don't mean bringing back production, but means increasing the awareness of the supply chain and understanding that your supply chain is global. So you need to act globally and you need to build these alliances and cooperation.
Thanks a lot. That's clear. There is another very interesting question. And this is a question, related to vaccines and procurement. As I mentioned earlier in my, during the discussion, government now they have to run this like monumental task of procuring and distributing vaccines. So I would be interested in maybe Vinay, because the World Bank is closely involved in this, and maybe also the Italian perspective with Roberto Chiepa. The question is on vaccine and procurement. How do you see this playing out in the coming months, years, in terms of international cooperation? So what are you seeing, Vinay, at the World Bank level? And then Roberto, maybe what is your experience now at the Italian level, at the EU level?
Well, I think that one of the hardest lessons we learned in that COVID-19 pandemic that this COVID-19 can lead to collapse of the health system, however solid, of any nation. I think that we have to remember this also the second phase, also during the vaccination phase. And so I think that we decide to centralize also the system of acquiring vaccination, also all the vaccination campaign with the special commissioner that I explained in my first answer. I need that there is the need. I think that there is the need to cooperate at an international level, because we have not to forget that there are more developed countries that will be able to acquire and to give to their population vaccine in a better way than other not so developed countries. And so I think that for vaccination is not possible a nationalist approach, and it is necessary to have an international approach to avoid this inequality. And I'm also about the first question. I'm afraid to have, as I said before, a national approach. Some form of nationalism also in public procurement that remains after the emergency. We have to avoid it because, of course, every nation, every country try to be autosufficient for acquiring PPI and other equipment. But this cannot transform our market, our economy, in a closed nationalist economy, coming back compared to the past.
Thank you, Vinay.
Thanks a lot, Enrico. I think if the first phase was complicated in terms of supply, I think the phase relating to the vaccination, to the supply of vaccines, is going to be infinitely more complicated. And that is because we are talking about vaccines that are of different kinds, that require different cold chains. As you know, Pfizer requires a -70°C. There are others that would require a less stringent requirement. We are talking about the period that they can be stored, which is rather limited. We are talking about almost 8,000 jumbo jets of vaccines being flown all over the world. We're talking about vaccination that is going to be done in a relatively short period of time, infrastructure to be created, health sector professionals to be trained, and so on, so that the last person is vaccinated. And what the World Bank is doing is, of course, working with other international organizations like Gavi and all that to ensure an equitable distribution of vaccines across the world, but also doing a readiness review of the countries in their capacity to be able to vaccinate. So this is an exercise that is being done, but the matrices are so complicated and so complex that I do think that this would require all our efforts and working together, and we cannot take a national centric view in this. We'll have to take a view which is broader than that. Thank you.
Thank you. And it's great to see Anna Cristina back with us. There is a question, maybe Anna Cristina, if you want to answer. There is a question from the public on our opinion on urgent procurement. And the question is why during the second wave we still have urgent procurement, where procurement is carried out without proper publication. And also it's a general question on whether the speakers, they think that this is going to be the new normal. Or is, the question reads, or is this the incapability of public officials to prepare in time between the waves? I think that's not really the reason. But generally, do you think that this emergency procurement will last? For how long is going to last? This pandemic can last for years. It's not going to go away by the end of 2021. So the question is this going to be the new normal?
Well, Enrico, I'm not sure if now this is working properly, but this is a lesson from the crisis in 2020. You have to be resilient. So my laptop, I don't know what happened, but now I'm in the cell phone. So on that regard, I believe there is an issue of narratives here, and we need to be very careful on that because we're international organizations, we are academia, we are practitioners, and we need to stop that thinking that emergency procurement is bad and we are not following controls, and that is going to happen in the second wave. We have learned a lot during the first wave. We have been approaching governments, and governments have been approaching international organizations to be different and to manage differently that second wave. At least for Latin American countries, they are publishing what they are their contracts. They are publishing more information about those households that are receiving subsidies. They are publishing the firms. They are publishing information that they were not before in place. So I do believe that we are changing and we are fine-tuning things, but governments are aiming to change for real, not just because of the crisis. At the beginning, we didn't know what to do, but now we have so much accumulated knowledge that we need to work on that. And we have all of these digital tools that I know all of the gentlemen here were talking about. So that's another thing. We need to start using that. I don't believe it's going to be the new normal. The new normal, the only thing that is going to be the new normal is that you have to assess risk, you have to address risk, and you have to see public procurement in a different way, a more strategic way than it was before. It's not more back office function. Now it's at the forefront, and probably it will be like that for the next 2 or 3 years.
Thank you very much. And dear public, thank you very much for the great questions. Unfortunately, we are running out of time. So let me conclude by going back to our original question. So in the fight against COVID-19, is it possible to reconcile speed and urgency with integrity and transparency? And I guess the answer coming out of our panel discussion is a resounding yes. With citizens' lives on the line, with public spending at record high, ensuring accountability to citizens not only is possible, but actually is imperative if we want to maintain trust in public institutions, and also if we want to effectively manage a crisis response. And I think our eminent speakers have provided a number of recommendations, suggestions for government to implement and to achieve this, to be able to reconcile speed and integrity. And I would just like to leave you with 3 of these recommendations. I believe we all agree that, first of all, the government needs to support open, complete, high-quality procurement data. That's, I think, is the foundation of our exercise. Secondly, I think governments need to embrace digitalization. They need to embrace technology. This is the only way to gather and to process and to give a meaning to this huge amount of data that we are receiving from the procurement institution, the governments are receiving. And I think finally, government needs to create a conducive environment to enable all the oversight bodies in the country, including in particular the civil society, to perform a very important role, which is the role of monitoring, effectively monitoring, as some of our speakers said. It's very important to monitor. So we need to create an environment that allows the oversight institution to monitor, effectively monitor these big data, and ultimately to ensure that the public money is used to fight the COVID-19 pandemic. So thank you very much. I hope you enjoyed our session. Thank you to the speakers. Thanks a lot. Thank you to the public. Thank you to the World Bank Law, Justice and Development Week team, and in particular to Dolly Shane, who helped us with all the organization. And thank you to my colleague Anna Rautzep, who helped me put this session together. Thank you and goodbye.